Lyme disease is a progressive disease that's transmitted through tick bites. Thousands of individuals are infected each year, particularly children between the ages of 5 to 14.
The onset of Lyme disease includes symptoms such as fatigue, chills, fever, headache, muscle and joint pain. Typically 3 to 30 days after infection, muscle weakness, numbness in face, and a tingling sensation can be found. Because these flu-like symptoms can be seen in many different diseases, Lyme disease is often difficult to diagnose. If it's left untreated, the disease can even become debilitating.
A unique symptom of Lyme disease is a red rash that develops around the site of the tick bite, called erythema migrans. This is an oval, uniformly red rash-like area, although sometimes has a bullseye appearance. The rash can be warm to the touch and is generally greater than 2 inches in diameter.
Good morning, Mrs. Renew. How are you feeling today?
I have flu-like symptoms, but I also have this weird rash.
How long have you had that?
I don't know, like a week or two.
Have you gone outdoors anywhere?
I went camping a couple weekends ago.
Well, this rash has a bullseye look called erythema migrans, which usually causes Lyme disease. We're going to have to check you for that.
Okay, sounds good.
So I'm going to prescribe you doxycycline and penicillin, which are two of our best antibiotics for Lyme disease. If no improvements within the next 2 weeks, please come back to see us.
Thank you.
Lyme disease can be treated by a regimen of antibiotics. Currently, however, there is no vaccine available for the prevention of the disease. This makes it extremely important for one to be aware of preventative measures that can be taken to lower the risk of contracting the disease.
Prevention includes reducing your exposure to ticks by avoiding wooded areas with high grass and leaf litter.
Always wear insect repellent that contains permethrin or DEET when going outside in these high-risk areas. And be sure to follow the instructions on the bottom. Be sure to wear clothing that shows as little skin as possible, and always wear a hat.
Be sure to walk in the center of the path and stay as far from the foliage as possible.
Change clothes and shower as soon as possible when coming in from outdoors. This removes any unattached ticks from the body. Also, check your body for ticks that may have attached themselves. Common areas of attachment include underarms, around ears, behind knees, and especially in hair.
It is important to inspect and treat all items that were exposed to ticks. This can be done by drying all clothes at high heat for 60 minutes.
Don't let yourself or your loved ones fall victim to this infection. Always use preventative measures. Be sure that your loved ones are as informed as you are. Although Lyme disease is not 100% preventable, these steps can be taken to reduce your risk of infection.
Take time and learn how to prevent the spread of Lyme.